Hello, everyone. This is Dr. Glenn Hoey, a naturopathic physician, with another presentation on Facebook here. Thanks for tuning in and joining us here. We wanted to talk about some other issues that I typically see in our office. One of those is mood disorder. I mean, typically the top five symptoms that we're going to see usually are fatigue, inability to lose weight, mood disorder, depression, anxiety, joint pain, hot flashes, and libido. So we talked about libido a couple weeks ago there when it was the theme of Valentine's Day. So I really wanted to touch upon mood disorder, including like depression and anxiety, and let people know that from a preventive perspective and also from just a natural holistic perspective, there are a number of substances that our body produces naturally that are antidepressant and anti-anxiety, and we don't necessarily have to rush to get a prescription for something, and most of the time the standard antidepressant approach has a number of side effects, especially weight gain, and most of the time it's just kind of going from a really horrible feeling to like a blah feeling. And many of them also are very hard on sexual function. They create a lot of unfortunately low libido and disinterest, and certainly that's not good for relationships that people have. So I want to talk about the natural ways that you can boost your antidepressant substances in your body. And some of them are nutritional, and some of them are definitely hormonal. And I'm seeing more and more of this epidemic decrease in the production of progesterone. We'll start with progesterone, especially for women. Progesterone is a wonder hormone. It really, truly is. And it is necessary for many, many functions, including regulating a woman's menstrual cycle and allowing a woman to be more able to have children and to retain children there so that the pregnancies go very smoothly and very effectively for the 40 weeks duration. And when women are miscarrying often or having a difficult time getting pregnant, rather than jump into lots of in vitro fertilization efforts that are thousands of dollars, quite often what we would do is get their progesterone levels drawn in the lab there, and we'll see oftentimes very, very low progesterone levels. And once we put them on $20 of progesterone, many women are able to conceive, and they do fabulously well. So that's one of the main things that progesterone is great at, but really it is a wonderful natural antidepressant and natural anti-anxiety hormone. And it is doing that by just calming and relaxing the body at a neuromuscular level. It's wonderful. It is a treatment I use quite often for migraine headaches as well, when there have been few options that have worked very effectively for women, especially that they can see the connection to their menstrual cycle. So progesterone, and typically we'll start 100 milligrams or so, and we see this in women, in their teens, young women in their teens, older women. I mean, we just see this as, like I said, an epidemic issue going on. So progesterone is one of our main treatments, and we can do it for men as well. It's not unusual for men to take 100 milligrams of progesterone, and you take it at night because it will help you sleep like no other thing will. So quite often when we think holistically, we're seeing women come in and they have sleep issues, they have anxiety, they have depression, and I automatically think progesterone is going to be one of the things that we're going to work with there, absolutely. Progesterone is great for bone density. It's for older women here who are perhaps at menopause or beyond. It is the one hormone that actually promotes the formation of osteoblasts, or bone-forming cells, to complement estrogen levels, which are helpful for like reducing the loss of bone. So they work hand in hand. Plus, estrogen is wonderful for the cardiovascular system and brain. Very sad that it gets a lot of negative press, thinking that it's associated with cancer. And interestingly enough, when I think about progesterone, progesterone's job is basically to counterbalance the effects of estrogen. Yes, estrogen is a cell proliferator, absolutely. But progesterone's job is to basically counterbalance that. It's like having a brake in your car when you have an accelerator. And, you wouldn't have one without the other. And, it's unfortunately that we blame estrogen really for these estrogen sensitive cancers, and I'm going, well, we're not doing enough to evaluate vitamin D levels and progesterone levels and DHEA levels in women because we're not measuring any of that. So very sad that that's what's going on. But progesterone is a wonderful, wonderful antidepressant. Another really effective antidepressant, and quite often we tag team both of them, is thyroid. And we do a lot of specialty work with thyroid. I have been using desiccated thyroid extract in my practice for well over 35 years and consider myself a pretty fair expert on the use of desiccated thyroid extract. And what's different about it than you say you're on levothyroxine, which is a synthetic T4. Well, desiccated thyroid extract is a combination of both T4 and T3. T3, or liothyronine, is the hormone basically that rejuvenates you, that gives you more energy, not only in a physical level, but also at a mental and an emotional level. So many times people come in and will use the word depression, where upon further evaluation, it's like, you're really just not motivated. I mean, you just don't have a lot of motivation going on. And so that's a big problem, is that it isn't that you're depressed, it's just simply you don't have a lot of mental and emotional energy taking place there. And that's typically thyroid. And we'll see issues with weight gain that they can't lose, especially women who've had babies, a very common kind of situation that we see all the time. And so thyroid works as a motivator. It's like, hey, an energizer, that's what it does. And we use it like 2 to 3 grains or whatever is necessary. Thyroid's measured more in grains, which is like 60 milligrams per grain. And, it's just a language unto itself that those of us who use desiccated thyroid extract or would prescribe liothyronine solely, or in addition to if you're taking levothyroxine, because sometimes insurance companies won't pay for desiccated thyroid extract. Well, they'll pay for liothyronine. And the medical literature is absolutely filled with study after study after study of people who were taking T4 only, levothyroxine, being put on liothyronine in addition and waking up, feeling better, losing weight, being happier, having more energy. And as soon as the liothyronine was stopped, they reverted back to like the kind of old grumpy self again, at low energy, weight gain again. And it's the same thing when we've done the difference with switching levothyroxine to desiccated thyroid extract, which is basically both T4 and T3. So don't underestimate thyroid. The problem we have with thyroid is that most of you are going to get a TSH test done because that's what your provider is familiar with. And the TSH stands for thyroid stimulating hormone. So it is a messenger hormone from your brain to your thyroid saying, okay, we think you're doing okay because we're sending you this message and you're in this reference range, so you must be normal. I said, well, normal doesn't necessarily mean it's optimal. And that's one thing we spend a lot of time educating our patients on, is normal doesn't always mean you're at the top of your game. What it means is you're basically caught in a statistical average, based on the numbers. And when we're seeing a population, from my perspective, becoming more and more hypo or low thyroid in their qualities and behaviors, like low energy, can't lose weight, dry skin, hair falling out, maybe sluggish bowels, all kinds of things, low immune system function. These are all signs and symptoms of low thyroid. So those two hormones there for women, progesterone and thyroid, are amazingly antidepressant. And oftentimes we'll have women on both, and we will see miraculous results. Now for the guy side, guess what? It's testosterone. Testosterone is a major antidepressant for a guy. And I am seeing the same kind of epidemic issues with younger men, starting age 18, 20, coming in not even in the standard reference range for the production of testosterone. And testosterone numbers run 600 points wide. It's like trying to throw a dart at a wall and not missing, you can't hit the dart, the wall. It's unbelievable that Young men, 18, you should be really at the top of your game. You should be producing a ton of testosterone. And 18 years old, they're not even in the reference range. And guess what happens? They're depressed, they're moody, they're anxious. I'm going, yep, that's exactly how you're going to feel without testosterone in your body. And we use ways then to boost testosterone, especially for younger people, because then we'll improve the production through the pituitary process there. We use Clomid, which is a fertility drug. Now the generic is clomiphene. And typically a 25 or 50 milligram pill you drop down once a day makes huge differences in the span of anywhere from 2 weeks to 4, 5, 6 weeks. Men are coming back in, young men coming back in. I can't tell you how much better I feel. We redo their baseline labs in 12 weeks, and a testosterone level that was 250 is now 1,000, and they feel dramatically better. So same thing with testosterone. It has gotten bad press for whatever reasons, thinking that it increases your risk of prostate cancer. And I can't tell you how incredibly inaccurate that is, because testosterone not only does not increase your risk of prostate cancer, it actually treats it. We've been using it to treat prostate cancer. We can use it to decrease your risk of prostate cancer. Testosterone, along with estrogen, are some of the best ways to prevent the production of atherosclerotic plaque in your arteries here. And we've done nothing but give testosterone a bad name. Oh, it's bad for your heart. And going, no, as a matter of fact, on the contrary, it's probably one of the best things that you can have in your body, despite your age. We have 70-year-olds taking it. I'm 65, I'm taking testosterone, and I feel great. I've got 80-year-olds taking testosterone, and we watch their cardiovascular inflammation markers, and we see them all come down as a result of being on testosterone. Why? Because it's a natural, not only antidepressant, but it's a natural anti-inflammatory. It's a builder, it's a repairer. You have to remember your heart's a muscle. I call it a muscle on a timer. And your body needs to repair the muscle. And that's what an anabolic hormone like testosterone does, is it builds and repairs. Any age. I've watched a guy come in at the 90s, watch his numbers come back tenfold from 70, which is really low, to over 700 in 3 months there. And it was funny because he was buying sildenafil, he was buying Viagra there, because his whole body was coming back to life. It was a very joyful story. And I said, okay, if he's doing that at 90, do the rest of us have any excuse whatsoever at 40 or 45? Of course not. So those are very, very important hormones there. Progesterone and thyroid can be for both men and women, and testosterone especially for men, but testosterone does work for women as well. We do prescribe it. The other substance that I want to talk about that, again, is kind of a natural antidepressant, is a little bit less of a hormone, more of a neurotransmitter, and that's serotonin. And serotonin is this substance that we produce, and we produce a lot of it in our gut, in our gastrointestinal system. We also produce in our brain. And it is due to the conversion of an amino acid called tryptophan. So we have to have complete proteins, or at least amino acid foods that have a lot of tryptophan in it. And then it converts to this substance called 5-hydroxytryptophan, which then converts to serotonin. And serotonin is a feel-good hormone, and it allows you to sleep better. So interestingly enough, as we're looking at serotonin as being helpful, and one of the first things that I'm going to do is work with people's protein intake and make certain that they are getting adequate amounts of protein in their diet to cover all aspects of their production, musculoskeletal building and repair, immune system function, but also serotonin. And one of the best sleep aids I've ever given as advice to people is get about a 20-gram protein snack sometime between dinner and bedtime. And oftentimes that will actually improve the production of 5-hydroxytryptophan into serotonin later in the evening. I've gotten up many a time when I've not had the protein that I needed for the day, and at 1 o'clock in the morning we'll go and get a ready-to-drink protein shake and drink all of it or half of it or something, and then go back to sleep. And that protein will then convert into 5-hydroxytryptophan and convert ultimately into serotonin. And within a half hour or so, I am comfortably going back to sleep and wake up fine in the morning. There are no hangovers, no ill effects whatsoever. So there are plenty of things that we can do naturally to improve antidepressant status in your body that you have right there. And the majority of times it is just simply being underproduced or less than optimally produced. And many of these things are so inexpensive to do. It's worth looking at. All it takes is a simple blood test and a consultation. We can work with anyone, anywhere in this country, even internationally. If you have access to a lab, we can get your labs drawn. We've obviously got phone system. We have email. We can work to communicate with you. And then we can get you to either a local pharmacy, because many of these things, like progesterone, are at your standard pharmacy, or compounding pharmacy if you've got one in your area there. All of these work extremely well. So I hope that's been helpful for you there. I mean, we do a lot with this. We see this all the time. So you don't need to be on an antidepressant there. I mean, like I've mentioned, the side effects, and you'll get so much better relief and improvement in so many ways in your life with either using thyroid or testosterone or progesterone, or sometimes a combination of all of those, and improving your diet with higher protein levels so we can produce that serotonin even more effectively. So thanks for listening. Until next time, this is Dr. Glenn Hoey, naturopathic physician. Thanks again for watching.